Set Employee Benefits presents Health Savings Accounts, Reducing Costs for Employees and Employers. With healthcare premium increases continuing to outpace inflation, employers are looking for ways to rein in costs. In many school districts, there's a cap on the amount of premium the employer pays, meaning the employee contributes the difference. Set Employee Benefits has several creative solutions for health insurance that can save everyone money. Among them is a high deductible health plan, coupled with a health savings account, or HSA. This approach saves money because high deductible health plans cost less to begin with. And HSAs encourage people to shop around for the best healthcare value because they're spending their own money to pay for services until the deductible is met. Depending on the deductible levels, the carrier, and how many employees are in the group, high deductible health plans could save hundreds of thousands of dollars in premiums. Let's look at how a high deductible health plan with an HSA works for Ada, an employee of District A, compared to Betty from District B's Common School Health Plan. Both Ada and Betty have family coverage. District A pays a monthly premium of $1,000 for Ada's health plan. Betty's premium costs $1,400 a month, but her district caps its contribution at $1,200 a month, leaving Betty to pay the balance. That's $2,400 a year out of Betty's pocket that goes to an insurance carrier. But Betty's expenses don't end with her premium contribution. She still has a $200 family deductible. Then there's an office visit copay of about $5 and a $10.20 prescription copayment. For Betty and her family, those out-of-pocket costs really add up. Ada's HSA plan has a $2,400 deductible. To encourage Ada to select the high-deductible HSA plan, District A agrees to deposit $600 into Ada's personal HSA account. That's a tax-free benefit for Ada, and she has many ways to fund the remaining $1,800. She can deposit all of it into her HSA at one time, make pre-tax Section 125 contributions through payroll deduction, or deposit just enough after-tax money to pay her medical bills as they're incurred. Once her family meets that deductible, there are no additional health care costs. Meanwhile, Betty's medical expenses not covered by her plan mount up. By the end of the plan year, District A has spent $1,800 less per employee than District B. For Ada, the best-case scenario is that her family incurs no medical expenses and she keeps the $600 that her district deposited into her HSA for future use. Worst case, she used the $600 plus $1,800 of her own money to cover medical expenses and to meet the deductible. But even so, she's still paying less than Betty, who automatically hands over $200 a month to her insurance carrier, whether she uses the health plan or not. Advantage, Ada. With the HSA option, the employee and the district can save money. Of course, an HSA plan is not identical to the Common School Health Plan. It doesn't cover things like massage therapy and more than 24 chiropractic visits a year. But the cost of those extras add up to a big expense for schools and their employees. There are also some great advantages to the HSA option. Because of her HSA, Ada learns a lot about the cost of medical care. Since Ada spends money from her own account, she's a more frugal healthcare consumer for herself and her family. That's why high-deductible health plans are often called consumer-driven plans. They shift the responsibility for healthcare choices from the doctor and insurance company to the individual. These plans work because people want to protect their health and are motivated to ask questions about the cost and necessity of treatment. There's a lot of room for creative alternatives when setting up a high-deductible plan with an HSA. Some districts may decide to fund the entire HSA for their employees, but require employees to contribute to the premium. Employees can do that using pre-tax dollars if their district sets up a Section 125 premium-only plan as part of its cafeteria plan. Other districts may split the deductible with their employees or come up with some other apportionment of payments. There are a few things to keep in mind with HSA plans. Some carriers can start an HSA plan any month of the year. Other carriers base their plans on a calendar year. If you'd like to learn more, Set Employee Benefits can guide you through the choices and help design the plan that will work best for your district. Call your SEG account executive today. 1-800-292-5421.